Today, we repeat our call for governors who have not yet implemented physical distancing in their states to do so immediately. Now, in truth, the nation needs more, much more, from our leaders. The public is already making incredible sacrifices by acting on the evidence. All of us need to trust that our institutions are also keeping science at the fore of their decision-making. We call for an environment in which physicians, scientists, and other experts are free to communicate evidence-based factual information without fear of retaliation or retribution. We call for the robust collection of data, including data segmented by race and ethnicity, to make sure we have a thorough understanding of the pandemic's impact on every community. Misinformation about COVID-19 is spreading rapidly, even intentionally, due to fear or to various political agendas. You may have heard some of these false claims yourself. African Americans are less likely to get COVID-19. That is false. Coronavirus is a new way to force vaccinations on people who don't want them. Also false. And children cannot contract COVID-19. False. Believing these kinds of rumors and conspiracy theories inevitably leads to more illness, more suffering, and more death. And that's why we all have a responsibility to seek out and share information only from credible sources.
What can we do to convince religious leaders to switch to online and phone services in place of large in-person gatherings?
Here's where we need the partnership, again, everyone, because I've seen many religious leaders encourage their parishioners and their churches and mosques and synagogues to really refrain from meeting in person. That gets back to our critical need to make sure that everyone is staying at home and sheltering in place. So here's a great partnership for ministers and rabbis and pastors who know and are working within their own religious institutions to remind everyone that we all have to act together. We all have that responsibility, taking responsibility to stay at home and not. And I know this is a holy time for everyone, but we can still experience this time, or I know this is a holy time for many. We can still experience those services remotely.
Let's talk a little bit about the role of journalists in helping inform the public as we all find our way through this crisis. Tell us why, in your opinion, journalism matters in a public health crisis like this.
Journalism and the media have always played a role in making sure that there's credible, accurate information out there, and certainly that becomes even more acute in times of crisis.